Hi, you guys. Welcome back for our daily practice questions. It's day 22, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 50-year-old patient presents with a chronic cough, fever, night sweats, and unintentional weight loss. Chest x ray reveals lesions in the upper lobes. The patient denies recent TB exposure and has no known history of TB. Which of the following diagnostic tests would be the best, most appropriate next step to differentiate between active and latent TB? Is it A, a tuberculin skin test, B, a sputum smear, C, no tests are warranted at this time, or D, repeat the chest x-ray in 6 months? Take a moment and tell me what you got in the comments, you guys. All right, you guys, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, which of the following diagnostic tests would be the most appropriate next step to differentiate between active and latent TB? So this patient has come in, right, and they're having classic symptoms of TB. The chest x-ray does reveal lesions in the upper lobe. Um, that can show that this could be, potentially active TB, right? But you need to do a confirmatory test to be able to differentiate one versus the other, whether it's latent versus active, right? So B would be your best answer. Doing that sputum culture would let us know and identify the bacteria source of tuberculosis to be able to give that definitive diagnosis of active TB. So y'all are probably familiar with seeing like the Mycobacterium tuberculosis that is often listed when we're discussing or reviewing lab values or different things in association with tuberculosis. Doing that sputum smear will allow us to identify if that is a positive, so then we can know that it's active at that point. Okay. Latent would be negative. Okay. So again, that best answer was B. All right. Question number two. A 30-year-old patient with no symptoms of tuberculosis is tested with a tuberculin skin test as part of a routine health check. The results show an induration of 12 millimeters. Given the result and no known history of TB exposure or symptoms, what is the next step in evaluating this patient? Is it A, initiate treatment for latent TB infection? B, order a chest x-ray to rule out active TB? C, perform a sputum test? Or D, repeat the skin test in 3 months? Take a moment and tell me what you got, you guys. Tell me what you got. Tell me what you got. All right, so stem of the question here states, given the result of no known history of TB exposure or symptoms, what is the next step in evaluating this patient? All right, so let's see what's going on. So we have a patient, they're asymptomatic, but their TB skin test shows a 12 millimeter induration. Depending on various things, this could be considered a positive. Like, for example, if they're a traveler or if they're a healthcare worker or if they've been in a highly populated area. So, of course, we'll need to identify more of their history. But they say they haven't been exposed to TB or anything. So, this could potentially be latent TB, right? But what you want to do is order that chest x ray, of course, ask the identifying questions, but also ordering that chest x-ray to make sure that it's not active TB that we are dealing with, so that you can proceed forward with latent management and treatment, okay? And lastly, question number 3, a 60-year-old patient with latent tuberculosis is being considered for treatment. The patient has a history of mild liver disease, but no other significant comorbidities. The most appropriate treatment regimen for this patient would be, is it A, rifampin for 4 months, B, I always just say INH for 9 months, C, rifedipine and INH for 12 weeks, or D, INH for 6 months? What do you think? All right, stem of the question, the most appropriate treatment regimen for this patient would be. So again, we're talking treatment. You got to run it back and look and see what we're treating, right? Have they provided you with a diagnosis? And in the event that they have not, you run it back a step further and look at the assessment findings. But they have provided us with this diagnosis. It has listed that the patient has latent TB. So how are we treating latent TB? And so the classic treatment for latent TB is B, INH for 9 months, okay? Again, if it's active, we do the 4, right? The rifampin, the INH, the pyrazidamide, and the ethambutol. But when it is latent, you can give that one therapy for a longer period of time. Um, Rifenipine is also utilized sometimes, but like I said, in this scenario, INH is the answer, and that 9-month period is classic for that treatment for latent TB. Okay, so B is your best answer. All right, you guys, I hope you found this helpful. I want to spend a moment identifying so that you're able to determine active versus latent, knowing what steps to take when you're trying to differentiate active versus latent, and knowing those medications and duration for the management of latent TB. Okay. But as I was saying, I hope you found this helpful. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, everything that I offer is linked in the bio of this channel. But you can give us a call at 803 400 6864 or shoot a text message to that number. You can also shoot us an email to thenursingstudio, the number 1 at gmail.com. And if you're looking to book any of my one-on-one sessions, any of my private coaching, tutoring for students, also any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.